Hysterectomies, the surgical removal of the uterus, is the second most frequent major surgery performed on reproductive-aged women in the U.S. And while it can be a life-saving procedure, some experts wonder whether the procedure is performed too often. Lurene Cachola has more.
According to the Department of Health and Human Services, a third of all American women will have had a hysterectomy, surgery to remove their uterus, by the time they're 60. The main reasons for the procedure are excessive bleeding, often caused by benign fibroid tumors, and pain disorders like endometriosis.
It depends on what's going on. Sometimes if we're just treating the bleeding and otherwise the uterus appears normal, we do have less invasive options available now, such as endometrial ablation, and this is something we've actually moved into our office, that the patient can have an in-office procedure and treat their symptoms.
Doctors try to weigh the need for surgery versus other treatments, but many times they determine that hysterectomy is the better option. The procedure traditionally requires surgery that opens up the abdomen, giving doctors access to the uterus. Recovery can be painful and take from 4 to 6 weeks or longer. Less invasive laparoscopic surgery has been in use for more than 20 years, but the rigid instruments usually used in the procedure are often cumbersome and can cause other problems, according to Dr. Bishop.
When we are actually at the bedside doing laparoscopy, we don't mean to, but we probably are pushing on the abdominal wall, moving the instruments from side to side.
Now, new technology is allowing a less painful alternative to both open surgery and traditional laparoscopic surgery. The Da Vinci system is a robotic device that uses small arms that are inserted into the body at 5 points. One has a camera that provides a high-definition view of what's going on inside the body. The doctor operates the device while sitting, using handles and foot pedals that control the arms with increased precision.
It is more effective because in just performing these little tiny incisions, the patients have much less pain. The recovery is much faster. Sometimes they can go home the same day. If they do stay in the hospital, it's usually just one night. It's rare that it's 2 nights.
Dr. Bishop says because of the time it takes to set up the machine, the robotic surgery may take more time than traditional procedures, an hour and a half, maybe a little longer. But she believes that the potential benefits, including fewer complications, a lower risk of infection, and less overall time in the hospital, should help make the technology more attractive to doctors and patients. For Smart Medicine, I'm Lurene Cachola.